We're seeing more and more that the cost of these drugs has significant impact on the patient's choices. The out-of-pocket cost is significant. Medicare, if patients do not, it's now moved from a medical benefit to now a prescription benefit. Patients are required to now cover anywhere from 25 to 30% of cost. That's significant. And one study that I actually reviewed recently talked about 1 out of 10 patients are less likely to fill their prescription. And the reality is that if the out-of-pocket cost is more than $500, potentially most patients will not cover it after a while. Earlier today, I was actually talking to one of my colleagues who was asking me about a prostate cancer drug. Drug costs over $9,000. And the reality is, how many patients have that kind of money where they're now required to cover 25% of the cost? And yes, there are prescription drug programs out there, patient assistance programs out there that are supporting that. But ultimately, as these costs continues to rise, that's something that we have to be mindful and think about. I may be completely idealistic in my thought process here, but I believe that if we can move away or move towards a medical benefit versus a prescription benefit, that would be significant. Why do I say that? If it's an intravenous drug, it's covered under medical. But if it's an oral oncolytic, it's covered under prescription benefit. So there is a disparity here. As we're moving towards more and more of all these oral oncolytics, we got to reevaluate how we pay for these agents, because now we've shifted the cost back to patients who may not afford it. And we're putting them between the rock and a hard place. I'm talking to a patient, they really, really, really want to go on that agent, and yet they know ultimately they can't cover it, they can't afford it. So there's going to be a need to have the conversation. How do we switch back to the point where patients could actually afford these therapies and not put them in a situation where they're choosing between what they would eat, they're choosing between, providing resources for their own barrier and going on a drug therapy that could potentially offer them a few months of life. That's really where patients find themselves, and that's where we're hoping that we'll be able to get to the point of having conversations so patients are not put in that spot.